Hi, and welcome back to Time of Death. I'm Ris, and we've got Dee here as per usual. This is our second episode, and Ris, me, will be presenting the case this week.
Yes.
Hope you enjoy. If you like it, subscribe and tell your friends.
Yes, tell everyone.
So this week, I chose to focus on Dr. Death.
Oh boy.
Dr. Harold Frederick Shipman. So, if you have heard of him, he's quite popular. He is one of the most prolific serial killers with around 250 supposed victims.
Wow.
He was born January 14th, 1946, in Nottingham, England, to his parents, Harold Shipman, who was a lorry driver, which for those of you who don't know, that's a truck driver. I had no idea. And his mother was Vera Britton. They were working class. They were of the Methodist faith. Fred is what family and friends called him.
Mm-hmm.
And although he is not our friend, we will still continue to call him Fred during this podcast.
All right, there we go.
So he was pretty aloof growing up. His mother encouraged him to believe that he was very special, and she kind of pushed that idea that he was kind of better than other people. So he kind of had that belief system ingrained in him at a young age. He was a middle child. He was a bit of a loner, but he also had a group of friends. He was very studious, very focused on his academics, and because of the pressure to study and work hard put on him by his mom, Vera, he wasn't able to develop socially and sexually as usual.
Mm.
And he was pretty selective with who he would call his friends. So he played rugby growing up, and during his time playing sports, he was noticed to be a little bit aggressive, which, you know, that's pretty typical in sports, but he had no aggression in his normal day-to-day personality at the time. He also ran long distance. He also was the vice captain of his sports team in his last year of school. When he was 17 years old, his mom, Vera, died from lung cancer.
A lot of parallels
Yes.
to last week. Like,
Yes.
very weird.
For those of you who didn't listen, it was Charles Cullen. He was a nurse. So you can have a listen to that if you're interested. So, because his dad was working, his older sister wasn't living at home, and his younger brother was only 13 at the time. He was the primary caregiver for his mom at the time of her diagnosis. So time went on, her condition was worsening rapidly. When she died, actually, he ran for hours and hours after her death in the pouring rain. I thought that was kind of interesting. So he was at school when his mom died, and there was based on what I read, there were some ideas that he maybe felt relief with her death. And which, I mean, she had been suffering for so long, so he felt some relief. And then I also read that they thought he did that excessive exercise with the running for hours until late into the night as like way for him to release more endorphins and get like a high, you know what I mean? Like more of a high from the whole experience. So during the time where he had been taking care of his mom, her general practitioner, who had been taking care of her at the time, Dr. Campbell, was administering morphine for pain relief. Towards the end of her days, the pain was getting worse and worse, intractable. As you know, we give morphine and other opioids and other medications for pain relief and just to make patients more comfortable towards the end of their death. So Fred was able to visualize the relief that his mom would feel from getting the administered morphine. It's kind of odd because Fred didn't divulge to his friends that his mom was sick at all, which was interesting to me. And he did not have any interest into going into medicine before his mom's death, too. So I don't know. I know a lot of times people will have a like life-changing experience, which leads them to go into medicine. So that's just an interesting tidbit.
Yeah, that is interesting. Everyone gravitates to healthcare for different reasons, you know. But it seems to be when they lose their moms, it's like a turning point for them, or at least a parental figure.
Well, he was very, very close to his mother, and other family members said it was a little too close, like it was a little too intense of a bond, which is interesting as well. So I don't know, it just hit him really hard, or
it's like a little, what is it, Oedipus complex?
Oh, yes. Maybe that can apply here. He struggled with getting well enough grades to get into medical school. So he wanted to go to Leeds University. He struggled. He wasn't able to get in, and so he reapplied, and he got into Leeds in 1965. He began studying there, and it was there where he met his future wife, Primrose Oxtoby.
I like that name.
It is an interesting name. Yeah, it's pretty. I never heard the name Primrose.
I could see you getting another cat and naming it Primrose.
For those of you who don't know, I already have two, Bubba and Wolfie.
Wow.
They met on the bus. He was 19 at the time. She was 16. She had been enrolled in a design program. And so they got together. She got pregnant soon after they started dating, out of wedlock. And this was the 1960s. So that was pretty rough for both families. So they married shortly after, about 6 months after they met. And interestingly, there's no photographs of the wedding. And they ended up in the future having 4 children together. Here we're going to get into the nitty gritty. He began working at Pontefract General Infirmary in Pontefract as a junior doctor. And about 12 months after that, he was fully licensed. There is a lot of speculation about when his first murder took place. I found like a bunch of different murders that could have been the first murder. One that I saw that was interesting was there's a little 4-year-old girl, terminally ill. Okay. Her mom left the room to go get a cup of tea and told Harold, please be kind to her. I don't know if Harold took that as a, go ahead for him to kill the little girl. But he did. Mom wasn't present for the death. I don't know how exactly he did it. I can't find that, but there's some speculation that she was his first kill, and maybe that was done for mercy, but I don't know.
She was terminal then.
Yeah, she was terminally ill.
Wow, maybe 4.
Yeah, a little toddler, little 4-year-old, and it's terrible the mom wasn't able to say her last goodbyes to the little girl too. At Pontefract, he began taking pethidine. Pethidine is like the UK version, I guess it's Demerol here in the U.S.
Oh, so he had an active drug addiction on top of everything else.
Oh, yes. So he was heavy. I'll get more into that in just a second. Pethidine, for those of you who don't know, meperidine is another name. Demerol is what we call it in the U.S. It is a synthetic opioid analgesic. It was originally as an alternative to morphine, and it was supposed to avoid side effects of morphine, like constipation, respiratory depression, urinary retention, all things that people who take opioids have to deal with for the most part. But it's still, surprise, surprise, it's still causes those side effects. It's not really used today because there's a highly addictive side to the Demerol, and it can also cause things like kidney dysfunction. And other safer alternatives are now more commonly used. But at the time, it was pretty widely used, especially for things like childbirth. It was a very common medication. So to talk more about his drug use, his history of addiction, in grammar school, he applied Sloan's liniment on his muscles. So Sloan's liniment is like a salve that's still used today. That's got things like turpentine oil in it, and it also has pine oil, and it has capsaicin.
So he was real tingly.
So it had a very tingly sensation and smell to it. He started inhaling the Sloan's liniment.
What?
Yeah. So he started off at a young age with that. He also, he was a kid at the time. He had been getting drunk with his friends and just kind of veered towards those escapist routes. So he's working at Pontefract, and then in 1974, he took his first position at Abraham Ormerod Medical Center in Todmorden as a general practitioner. He had 2 kids at this point with Primrose. He had a budding reputation that he developed here. He had a group of patients who really adored him, but his addiction actually spiraled more at this point. He was still taking the pethidine, and he would shoot up every 2 hours with the pethidine, and he would sometimes add alcohol to the mix as well.
So this is what is amazing, because I feel like a lot of, like, especially like in healthcare, they're able to compartmentalize really, really well. Like, you have an active drug addiction, you're like having to shoot up every 2 hours, you're drinking alcohol, you're hiding all this, you're having a family, you're a loved physician. Like, that's a lot to manage.
Yeah, it's a lot of stress that you have to kind of sort out.
And then on top of things, you're killing people. Like, like, that's crazy.
So actually, another source I found thought that the first death, his first death, was actually the first death certificate that he ever signed. Her name was Ruth Hiley. This was in 1974, around the same time as when he started at Todmorden. So she was a 72-year-old female. She was pretty sick at the time. Her cause of death labeled on the death certificate was hypothermia and kidney.
I have 2, so I'm really fucked.
Yeah, just 1 kidney here.
You do not have 1 kidney. Wait, let's just back that up. You definitely have 2 kidneys.
I'm talking about Ruth Hiley.
Okay.
I have 2 kidneys still.
Don't come for us, though. Don't try to steal any of our... That's like a black market.
We probably shouldn't tell anyone we have 2. So Ruth, there's some question. Maybe she reminded him of his mom, Vera. Maybe it was a mercy kill. Who really knows? But she was an older female victim, which was his usual population that he went for. So he would not delegate, like obtaining blood samples, giving medications to other staff like nurses. He wasn't a delegator at all, which was a little suspicious. His time at Todmorden, he actually went to 3 different patients' houses and killed all 3 patients in one afternoon.
Hold up. Why did he go to these patient houses besides to, like, would he like, oh, let me in, please let me in, sir?
So he would focus on single, elderly, vulnerable patients, mostly female. But on this day, which was in January 1975, he killed Lily Crossley, a 73-year-old female. He had gone to see her for a checkup. He then killed Elizabeth Pierce, who was an 84-year-old female. And then to finish the day off, he killed Robert Lingard, a 63-year-old male. They were all in good health. They all had kind of vague reasons for their death listed.
How did he kill them?
So he used morphine to kill these patients. He typically killed them in the afternoon, and they were typically found fully clothed, sitting upright in a chair or on the couch. So they looked pretty peaceful when their bodies were found.
Trigger warning. A lot of times when these killers, there's a sexual element, the victims are not clothed. So it sounds like maybe he really was symbolically trying to kill his mom.
A good point, Dee. I didn't read anything that any of his crimes had a sexual component to them. But talking again about their position that they were found in some cases, Shipman actually said that he performed a full external examination of his victims' bodies.
That's really creepy.
But they were always fully clothed. Like, did you take them off and then do your full external exam and then put them back on? I don't see that. So I think it was all an embellishment. With these deaths, the cause of death didn't really line up with the appearance of their body or their patient history. It could say, that the patient had an MI or a heart attack, and they're just sitting peacefully on the couch, which, that can happen, but he used morphine, which, interestingly enough, is able to be traced in the body long after the victim is dead.
Good. Thank God for that.
Yeah. Yes. So that brings the question, was he not smart enough to realize that, or did he want to be caught? That's why he used morphine? I don't really know. He killed hundreds of people. Something I found that was really sad is that a lot of his victims really looked forward to the visits with Shipman, and they often wore their best clothes for his visits. So Fred would encourage the families of his victims to opt for cremations for their loved ones.
So then they can't do the autopsy.
Yep.
I just want to jump back. When you were talking about how he used morphine, like, did he not realize? Maybe because it was, like, more important how he killed them. Because that's how his mom passed. And I know I keep harping about his mom. Oh, maybe he's trying to, recreate that. Who's to say? Maybe his mom wasn't his first victim.
Yeah, I know. I see what you're saying. I think that situation with his mom really sealed the deal for the rest of his history. And I do think he stuck to the use of the morphine because that is how his mom died. There's some thought that he was trying to recreate his mom's death when he was trying to kill these people, and that's why he did it. So in 1975, he was caught forging those prescriptions of pethidine, which he was self-medicating with, as we know. And he was fined 600 pounds, went to rehab, and his license remained intact, but he was forced out of the practice that he was part of at the time.
And then we have nurses losing their licenses over just any freaking thing. Yeah. So I'm telling you, there's a huge disparities how doctors get a little slap on the wrist. Nurses, a lot of times, they're the ones who get thrown under the bus. Mm-hmm. That's super sad, and he should have gotten in so much more trouble for that.
Yeah.
And then this all could have been nipped at the bud. Mm-hmm. To say, if he had lost his license, maybe we could have saved all these people from dying.
That's true.
What is pounds to, I don't even know.
I don't know what the American value of that is, but it was pretty insignificant from what I saw. So in 1977, however, he got a job as general practitioner at Donnybrook Medical Center in Hyde. Mm. He was very open about his previous issues with drug use. And they liked that he was so open, and they hired him. He stayed here well into the 1980s and continued killing.
Wow.
He was popular, well-liked here. Hyde was a small, very accepting community, so he really thrived there. In 1993, he moved on and started his own practice at 21 Market Street in Hyde. Now, this is where he just went crazy in his killings, and he had like 3,000 patients.
Oh my God.
Primrose was the receptionist for him, and he was open 7 days a week.
7 days a week?
Yeah. So he was just on another level at this point.
If it's a small town, then everybody in the town was going to this guy.
Everyone was seeing him, and he was well loved. So his patterns in 1998 were questioned by a Linda Reynolds. She was a general practitioner in Hyde, and she told the coroner, John Pollard, he was the coroner for South Manchester District. She said, you know what, I'm kind of suspicious about Fred because he's got high death rates for his patients. There's a large number of cremation forms for elderly female patients that needed a co-signature from her. Shit. And guess what?
What?
The PD said there's not enough evidence and closed the case 1 month later. In April.
You cannot trust these freaking regulatory bodies to do their fucking jobs ever. They literally just let them do. They just go buck wild. Like, there's not enough evidence. Sorry.
So after this, where they said, oh, not enough evidence, we're just going to move on. Mind your business, Linda.
This Linda.
He killed 3 more patients that we know of at this point. On June 24th, 1998, Fred killed his last victim.
Good. Thank God for that. Mm-hmm. And I hope freaking Linda had something to do with it.
Yeah, she did. So Fred killed a former mayor of Hyde. Her name was Kathleen Grundy. So he put on the death certificate, her cause of death was old age. He went to go see her that day to obtain routine blood samples.
Wait, hold on. I've seen death certificates. For someone to write old age, that's fucking wild in itself.
It gets crazier.
Old age. Like what? What?
Yep.
Listen, between the kidney and the old age, like, what is going on here? Like, I don't, maybe it was different filling out these death certificates back then. But now, like, if he were to put that now, oh.
Just out of the blue, this woman was very healthy. She was in good health. Kathleen's daughter, Angela Woodruff, was a solicitor, like a lawyer, I think.
Oh, I hope she got his ass.
Yeah. She got suspicious because another solicitor, his name was Brian Burgess, told her that Kathleen's will was suspicious. Okay. She left £386,000 to Fred and nothing to Angela and the rest of their family.
Are they like estranged? Like, is this?
No. They had actually made a will together a few years prior, and everything was set, and Angela was getting, I don't know what she was supposed to be getting, but it was all, signed and sealed. She also thought that the signature was a little suspicious. She thought it was forged. So Angela brought up her concerns to the police department. They opened an investigation, and Kathleen's body was exhumed, and they found traces of morphine in her body because it sticks around. And at the time, morphine had been used for pain relief in terminally ill cancer patients, really. So she was not the right population to have been receiving morphine, and it was a lethal amount of morphine at that.
Wow.
Shipman claims...
What a piece of shit.
Shipman claims that Kathleen was a drug addict.
Wait, what? Listen, I'm going to tell you this right now. He's fucked. He's fucked. Think about it. You're going to go down in history as a fucking grandma killer.
Mm-hmm.
Like,
little old lady
killer. What a piece of shit. You're a piece of shit if you're a killer regardless.
Mm-hmm.
But to be someone's killer of someone's grandma, like,
yeah,
fuck you.
Oh yeah. So he said Kathleen was a drug addict.
He's lying on her. That's really shitty.
And he showed his notes on his computer. Don't forget, this is the 1990s.
I didn't even know that there was computers in 1990s.
I don't know when the first computer was.
I was born in the 1990s, so we both were. So
and we did have computers growing up.
But I was like thinking like 2000.
I keep thinking he was like killing people in like the 1920s or something like that. But no, this is 1998 when he killed her. He shows in his computer, I have all these notes on Kathleen. And they all showed that he had suspicions of her drug use.
So this was premeditated. This was very, very clear. He's a sneaky little shit too.
So, listen to this. The police department took his computer and analyzed all the notes and all that. And they found that all those notes had been submitted after Kathleen had died.
You know what? He probably panicked when he heard they were going to exhume her body and let me chart to cover my ass. And if it didn't happen, don't chart it. Yeah. What is the saying? If it's not documented, it didn't happen.
Exactly. Very true. So, he was trying to follow that age-old rule. So, it gets better. He was also found to have a brother typewriter, which was the same one as Kathleen, that Kathleen used on her will. And they also found Fred's fingerprints on the will as well. So this was like so sloppy. And there's some more question about, okay, did he want to get caught? Did he want to retire? Did he just get tired of the killing sprees that he would go on? I don't know.
I think, Ris, that he probably was doing this to build up his little financial, and he's like, well, these ladies are loaded. I'm going to kill them anyways, so let me make myself the beneficiary.
So I was researching and I found He had asked for things from other patients' families, like nothing like this, but he asked for one patient's parakeet
What?
or parrot, one or the other, and they said no.
Fuck you, no. Not my fucking parakeet. That's my fucking parakeet.
Oh my God. So I don't know, but he got caught here. Okay. Also, so this all happened June 24th after she had died. In August 1998, John Shaw, he was a taxi driver, and he drove a lot of Fred's patients who looked healthy. They were bright, perfectly well, no apparent issues, and he drove a lot of them. And they died in Fred's care. And so he said, you know what? I'm suspicious. I think Fred killed 21 patients.
Wow.
September 7th, 1998, Fred was arrested.
Good.
And the police department found a pattern in 14 other cases in which he administered lethal doses of morphine to his patients, signed their death certificates, then fudged their records to show evidence of their declining health. More bodies were exhumed, more morphine was found. That made his case so much shittier. So on January 30th, 2000, he was found guilty of 15 counts of murder and 1 count of forgery. Thank you, Kathleen.
1 count of forgery, that's it.
Yep. Well, he just forged her will that we know of. He just asked for the parrot or parakeet.
He didn't will it to himself. He learned his lesson from the resounding no.
So he was imprisoned for life, no possibility of parole. And in February 2000, 11 days later, the General Medical Council removed him from the medical register. So he had lost his license at this point, thank God. So Fred never admitted to any of his crimes throughout this whole time. Primrose believed him to be innocent up until the end as well.
Oh, Primrose, you're
At least publicly. Who knows what, I mean, maybe deep down you have to know there's something.
She was the freaking receptionist.
Mhm.
She knows how many we're discharging him. He's dead. Like, come on, Primrose. Come on.
Smarten up, Primrose. On January 13th, 2004, Fred hung himself in his cell at age 57 from the bars of his window using his bed sheets. And this was so frustrating, as you can imagine, for families of all his victims because there's no answer. Fred never admitted to anything. He went to his deathbed saying, I'm innocent. And we will never know the true reason why he killed. Another source I found said that the total number now is believed to be 284 victims over a 30-year period.
He got away with it for 30 years.
Yep. I want to talk a little about motivation because I'm confused about why he did this. I think it may have started off as a mercy, has a mercy component to it, and then it morphed into he gets kind of a high from these deaths. There's some speculation that maybe he hated older women. There was a quote that said they were a drain on the health system. So I don't know, maybe he had some righteous idea that all older women should die. There was also speculation that, as we were just talking about, that he had increased pleasure associated with his mom's death. He wanted that sense of power. So he would kill and he would feel calm after. Another source, like I mentioned earlier, is that he was recreating the death of his mom with the administration of morphine. Something interesting I found is that he saved his cellmate's life. So his cellmate was like, I do not want to be roomed with this guy. He killed like 200 people. Like, I am just going to kill myself. And Fred had actually talked him down. They had become really good friends at that point.
Interesting.
Yeah. So, but he wasn't his normal population. The only male death I found was that Robert Lingard on that same day where he killed 3 total. That's what I have on Fred. Do you have anything?
No, I think that is like very, I don't know, there's a lot to unpack with the doctor death.
Yeah.
there's a lot to unpack.
He's kind of, it's really frustrating because he never gave a reasoning, you know? Like, I feel like I need a reason. I need an explanation. Even if it's a horrible explanation or horrible reason, I still want to know what was your motive for killing all these people.
I may not even know the motive behind why he did what he did, you know? Yeah. But I think that it really, you know, comes down to, I mean, it really comes down to the fact that these families deserve answers.
Yeah.
You know, and to be honest, like 1990s are not like terribly long ago. Like there's still, I'm sure, family members that are surviving and, you know, still wondering and asking questions.
Mm-hmm. It was interesting too because I read somewhere that the little old lady patients loved him, and they're like, well, you don't last very long, but he's great. It's just interesting to me. Like, he had such a hold on all these patients, and he took terrible advantage of them all. You know what I mean?
That's probably, you know, the very charismatic, and I'm just amazed like he was able to do all this. He again just compartmentalized really, really well. Obviously a fucking scum of the earth, but you know, there's something to be said about being a raging drug addict and, you know, being able to still be a physician and have 3,000 patients. And
no, and the pictures I've seen, the photos I've seen of him, something just looks off with him.
Let me see. I want to see.
Go look at a photo of him.
Looks like I wouldn't bat an eye twice to see him in the hospital.
So I don't know, I think it was probably in like his heyday. He started having blackouts, and the provider he went to thought it was stress related. They also diagnosed him with idiopathic epilepsy, but I don't know, maybe he was just
the internal conflict from killing all the freaking hundreds of people manifested physically.
I don't know, but something wasn't right there.
He even has like those like shark eyes. You know what I mean? Like those I'm dead inside eyes. And so the whole argument that older people are a drain on the healthcare system, at some point he is going to be the very same drain, and his loved ones and his wife.
Yeah. Well, he was 59 when he died, so maybe he's like, all right, I'm the drain. Time to go. But it was also interesting because I found another person that he killed, or he tried to kill. This was an attempt. Elaine Oswald, 25-year-old female. She had a kidney stone.
It's the fucking kidneys.
Mm-hmm. Those kidneys. Can't get away from them. He's like, oh, you know what, Elaine? I want some blood work before we do anything. So he goes to see her, and Elaine wakes up on the floor.
What?
Mm-hmm. Surrounded by EMS and Shipman, paramedics, all the works. They're like, you stop breathing. Dr. Shipman told her that she had an allergic reaction to something, but I don't know, maybe that was an attempt.
That's strange. Very weird. The time is 1930. It's 7:30 p.m. We're calling it.
Yep.
We will be back next Wednesday.
Yep. Next Wednesday, we'll have a brand new episode for you. Tune in Wednesday night. It's turning into spooky season.
Yes, my favorite season. Thanks for tuning in, guys. We're calling it Time of Death, and we're flatlining.